Okay, let's embark on a crucial journey, understanding and mitigating the common causes of senior injuries within the very place they should feel safest, their homes. This isn't just about preventing accidents, it's about preserving independence, enhancing quality of life, and providing peace of mind, both for seniors themselves and their loved ones. We aim to spend the next hour exploring these hazards, offering practical solutions, and fostering a proactive approach to senior safety. The statistics paint a stark picture. Injuries within the home are a leading cause of hospitalization and disability among older adults. These aren't minor scrapes, we're talking about hip fractures, head trauma, and other serious incidents that can have devastating consequences. Beyond the physical pain and recovery time, these injuries often trigger a cascade of negative effects, impacting emotional well-being, financial stability, and overall independence. Imagine a fall that results in a broken hip. Suddenly, a senior is facing surgery, rehabilitation, and potentially a long-term stay in a care facility. The financial burden alone can be overwhelming, with medical bills, therapy costs, and potential home modifications adding up quickly, but the emotional toll can be even greater. The fear of falling again can lead to anxiety, depression, and a reluctance to engage in activities they once enjoyed. This isolation can further exacerbate physical decline and diminish their sense of purpose. Furthermore, senior injuries at home place a significant strain on family caregivers. Often, adult children find themselves juggling their own responsibilities with the demands of caring for an injured parent. This can lead to burnout, stress, and a disruption of their own lives. The emotional burden of witnessing a loved one struggle with pain and diminished independence is immense. That's why a proactive approach is so vital. By identifying and addressing potential hazards within the home, we can significantly reduce the risk of injuries and empower seniors to live safer, healthier, and more fulfilling lives. This is not about stripping away their independence, it's about enabling them to maintain it for as long as possible. Therefore, let's dive into the specific culprits that contribute to these unfortunate events. We'll consider falls, of course, as the primary offender, then we will move into tripping hazards and other problems. We will consider these factors methodically, and then seek to find solutions. By focusing on preventative measures and readily available information, we can make a real difference in the lives of our senior loved ones. Now that we've established the gravity of the issue, let's delve into the leading culprit behind senior injuries at home: falls. Falls aren't just accidents, they are often the result of a complex interplay of physiological changes, environmental hazards, and underlying health conditions. Understanding these contributing factors is crucial to developing effective prevention strategies. The statistics surrounding falls are alarming. According to the CDC, millions of older adults fall each year, and a significant percentage of these falls result in serious injuries like fractures, head trauma, and even death. Falls are, in fact, the leading cause of injury and death from injury among older Americans. But why are seniors so vulnerable to falls? The answer lies in the natural aging process. As we age, our bodies undergo a number of changes that can increase our risk of falling. Our balance may become less stable due to changes in the inner ear, decreased muscle strength, and slower reflexes. Vision problems, such as cataracts or glaucoma, can impair depth perception and make it difficult to navigate uneven surfaces. Chronic conditions like arthritis, osteoporosis, and diabetes can also contribute to falls by affecting mobility, bone density, and nerve function. Imagine a senior citizen with arthritis struggling to maintain their balance while reaching for an item on a high shelf. The pain in their joints may limit their range of motion, making it difficult to regain their equilibrium if they start to lose their balance. Or consider a senior with diabetic neuropathy, a condition that causes nerve damage in the feet and legs. This nerve damage can impair their ability to sense their feet on the ground, making them more prone to tripping and falling. Muscle weakness is another major contributor to falls. As we age, we naturally lose muscle mass, a process known as sarcopenia. This loss of muscle strength can make it difficult to rise from a chair, climb stairs, or even maintain a steady gait. Regular exercise, particularly strength training, can help to combat sarcopenia and improve balance and coordination. Furthermore, certain medications can increase the risk of falls by causing side effects like dizziness, drowsiness, and confusion. It's important for seniors to review their medications with their doctor or pharmacist to identify any potential fall risks and explore alternative options if necessary. Beyond these physiological factors, environmental hazards within the home also play a significant role in falls. We'll be exploring these hazards in detail in the following sections, but it's important to recognize that falls are rarely caused by a single factor. Instead, they are often the result of a combination of individual vulnerabilities and environmental risks. By addressing both of these aspects, we can significantly reduce the risk of falls and empower seniors to live safer and more active lives. Having established falls as a major concern and explored the physiological factors that contribute to them, let's now turn our attention to a more tangible and often overlooked category of hazards, tripping hazards within the home. These seemingly innocuous objects can pose a significant risk to seniors, turning a familiar environment into an obstacle course. Rugs and clutter are two of the most common culprits. Area rugs, particularly those with curled edges or lacking a non-slip backing, can easily cause a trip. Imagine a senior walking through their living room, unaware that the corner of a rug is slightly raised. Their foot catches on the edge, throwing them off balance and leading to a fall. The impact can result in anything from a minor bruise to a serious fracture. Loose carpets present a similar hazard. Over time, carpets can become worn and detached from the floor, creating ripples and bumps that are easy to trip over. Regular inspection and repair of carpets are essential to prevent these types of accidents. Clutter, in general, is a major contributor to falls. Piles of newspapers, stacks of books, and scattered belongings can create an obstacle course throughout the home, making it difficult for seniors to navigate safely. Consider a hallway cluttered with boxes or a living room strewn with toys. These seemingly harmless items can become major tripping hazards, especially for seniors with impaired vision or mobility. Beyond rugs and general clutter, electrical cords can also pose a significant risk. Loose cords snaking across the floor are easy to trip over, especially at night when visibility is reduced. It's important to secure electrical cords to walls or furniture to prevent them from becoming a hazard. Even pets can inadvertently contribute to falls. A small dog or cat darting between a senior's feet can easily cause them to lose their balance. While we wouldn't suggest getting rid of beloved pets, it's important to be mindful of their presence and take precautions to prevent them from becoming a tripping hazard. The key to minimizing tripping hazards is to adopt a proactive approach to home safety. This involves regularly inspecting the home for potential hazards, removing clutter, securing rugs and carpets, and ensuring that walkways are clear and well lit. Think of it this way: imagine conducting a hazard hunt throughout the home. Walk through each room and carefully assess the environment for potential tripping hazards. Are there any loose rugs or carpets? Is there any clutter obstructing walkways? Are electrical cords properly secured? By identifying and addressing these hazards, you can significantly reduce the risk of falls and create a safer living environment for seniors. Moreover, it's important to encourage seniors to be mindful of their surroundings and to take their time when walking. Rushing or multitasking while walking can increase the risk of tripping and falling. Simple adjustments, such as wearing appropriate footwear and using assistive devices like canes or walkers, can also help to improve balance and stability. Beyond the tangible obstacles we've discussed, another critical yet often subtle factor contributing to senior injuries is poor lighting. Insufficient lighting can create shadows and reduce visibility, making it difficult for seniors to navigate their homes safely, especially at night. This seemingly simple issue can have profound consequences. Imagine a senior getting up in the middle of the night to use the bathroom. The only light source is a dim hallway light, casting long, distorted shadows across the floor. These shadows can obscure potential tripping hazards, such as a misplaced slipper or a slightly uneven floor surface. The senior, unable to clearly see their surroundings, missteps and falls. Poor lighting is particularly dangerous for seniors with age-related vision changes. As we age, our eyes become less sensitive to light, requiring more illumination to see clearly. Conditions like cataracts and macular degeneration can further impair vision, making it even more difficult to navigate in dimly lit environments. Consider the staircase, a notoriously hazardous area for seniors. Without adequate lighting, it can be difficult to judge the depth and spacing of the steps, increasing the risk of a fall. Similarly, dimly lit hallways and doorways can create obstacles that are difficult to see and avoid. The solution to poor lighting is relatively simple: increase the amount of light in the home. This can be achieved through a variety of means, including installing brighter light bulbs, adding more light fixtures, and using night lights. Nightlights are particularly important for providing illumination during nighttime hours. Place night lights in hallways, bathrooms, and bedrooms to help seniors navigate safely in the dark. Choose nightlights that are bright enough to provide adequate illumination but not so bright that they are disruptive to sleep. In addition to nightlights, consider installing motion sensor lights in key areas such as hallways and staircases. These lights automatically turn on when someone enters the area, providing instant illumination and reducing the risk of falls. Furthermore, pay attention to the type of light bulbs used in the home. LED bulbs are a good choice because they are energy efficient, long-lasting, and provide bright, clear light. Avoid using incandescent bulbs, which produce a warmer, dimmer light that can be more difficult for seniors to see. Finally, make sure that all light switches are easily accessible and within reach. Seniors with mobility limitations may have difficulty reaching for light switches, increasing the risk of falls. Consider installing light switches with larger, easier-to-grip toggles. By addressing poor lighting, we can significantly improve the safety and comfort of seniors in their homes. A well-lit home is a safer home, allowing seniors to navigate their surroundings with confidence and reducing the risk of falls and other injuries. Having addressed the importance of proper lighting, let's now turn our attention to one of the most hazardous areas in the home for seniors, the bathroom. This seemingly innocuous space is often a hotbed for slips and falls due to slippery surfaces, limited mobility, and the presence of water. Understanding the specific dangers within the bathroom and implementing preventative measures is crucial for ensuring senior safety. The primary culprit in bathroom injuries is, of course, wet surfaces. Tiled floors, bathtubs, and shower stalls can become extremely slippery when wet, creating a significant risk of falls. Imagine a senior stepping out of the shower onto a wet tile floor. Their feet lose traction, and they slip and fall, potentially hitting their head or fracturing a bone. The risk is further amplified by the fact that seniors often have reduced mobility and balance, reaching for soap, bending down to wash their legs, or simply turning around in a small shower stall can all disrupt their balance and increase the likelihood of a fall. Furthermore, getting in and out of the bathtub can be particularly challenging for seniors with mobility limitations. The high sides of the tub can be difficult to navigate, and the slippery surface can make it easy to lose their footing. Fortunately, there are several simple and effective measures that can be taken to reduce the risk of bathroom injuries. One of the most important is to install grab bars in key locations, such as inside the shower or bathtub and next to the toilet. Grab bars provide a stable handhold that seniors can use to maintain their balance and prevent falls. Non-slip mats are another essential safety feature for the bathroom. Place non-slip mats inside the shower or bathtub and on the floor outside the shower or bathtub to provide traction and prevent slips. Shower chairs can also be a valuable addition to the bathroom, particularly for seniors with mobility limitations. Shower chairs allow seniors to sit down while showering, reducing the risk of falls and conserving energy. In addition to these physical modifications, it's also important to address other potential hazards in the bathroom. Make sure that all toiletries and personal care items are within easy reach to avoid unnecessary stretching or bending. Keep the bathroom floor clear of clutter to prevent tripping hazards. Consider installing a raised toilet seat to make it easier for seniors to sit down and stand up. Raised toilet seats can significantly reduce the strain on joints and muscles, making it safer and more comfortable to use the toilet. Finally, encourage seniors to take their time in the bathroom and to avoid rushing. Rushing can increase the risk of slips and falls, especially when surfaces are wet. By implementing these preventative measures, we can transform the bathroom from a hazardous space into a safe and comfortable environment for seniors. A safe bathroom is an essential component of a safe home, allowing seniors to maintain their independence and dignity while minimizing the risk of injuries. Having navigated the potential pitfalls of the bathroom, let's now move into another area of the home that presents unique challenges for seniors. The kitchen. While often considered the heart of the home, the kitchen can also be a source of injuries due to reaching for high shelves, bending down to access low cabinets, and the ever-present risk of spills on the floor. One of the most common kitchen-related injuries among seniors involves reaching for items stored on high shelves. As we age, our range of motion can become limited, making it difficult to safely reach for objects overhead. Imagine a senior stretching to grab a can of soup from a high shelf. They lose their balance, reach too far, and fall, potentially injuring their shoulder, back, or head. Similarly, bending down to access items stored in low cabinets can also be problematic. The act of bending over can strain the back and knees, increasing the risk of falls. Consider a senior bending down to retrieve a pot from a low cabinet. They lose their balance, fall forward, and hit their head on the cabinet door. Spills on the floor are another major hazard in the kitchen. Water, oil, or other liquids can create slippery surfaces, increasing the risk of slips and falls. Imagine a senior walking across the kitchen floor. When they step on a puddle of spilled water, their feet slip out from under them and they fall, potentially fracturing a hip. Fortunately, there are several simple steps that can be taken to minimize these risks and create a safer kitchen environment for seniors. Point 1. Of the most effective is to reorganize the kitchen to bring frequently used items within easy reach. Store commonly used items on shelves that are at waist level or slightly above, minimizing the need for reaching or bending. Step stools with handrails can also be a valuable addition to the kitchen. These stools provide a stable platform for reaching high shelves, reducing the risk of falls. Choose a step stool that is sturdy, stable, and equipped with a handrail for added support. To prevent spills, encourage seniors to clean up spills immediately. Keep a roll of paper towels or a sponge readily available for quick cleanup. Consider installing pull-out shelves in lower cabinets to make it easier to access items without having to bend down. Pull-out shelves bring the contents of the cabinet within easy reach, reducing strain on the back and knees. Ensure that the kitchen floor is clean and dry. Avoid using slippery floor waxes or polishes. Adequate lighting is also crucial in the kitchen. Make sure that the kitchen is well lit, with bright overhead lights and task lighting over countertops and work areas. By implementing these simple measures, we can transform the kitchen from a hazardous space into a safe and functional environment for seniors. A safe kitchen allows seniors to continue enjoying cooking and preparing meals, maintaining their independence and quality of life. Beyond the physical environment, another often overlooked factor that significantly contributes to senior injuries is medication management. While medications are intended to improve health and well-being, their side effects and interactions can sometimes increase the risk of falls, dizziness, and other injuries. Understanding these potential risks and taking steps to mitigate them is crucial for senior safety. Many medications can cause side effects that increase the risk of falls. Dizziness, drowsiness, and lightheadedness are common side effects of many medications, particularly those used to treat high blood pressure, anxiety, and depression. These side effects can impair balance and coordination, making seniors more prone to falls. Imagine a senior taking a medication for high blood pressure. The medication lowers their blood pressure too quickly, causing them to feel dizzy and lightheaded. They stand up too quickly and lose their balance, falling and injuring themselves. Furthermore, certain medications can cause confusion and disorientation, which can also increase the risk of falls. Medications that affect the central nervous system, such as sleeping pills and sedatives, can impair cognitive function and make it difficult for seniors to navigate their surroundings safely. Drug interactions are another potential hazard. When seniors take multiple medications, the risk of drug interactions increases. These interactions can alter the way the body processes medications, leading to unexpected side effects and increasing the risk of falls. Consider a senior taking several medications for different health conditions. One of the medications interacts with another, causing them to become drowsy and confused. They are more likely to fall and injure themselves. To minimize the risks associated with medication management, it's essential for seniors to have regular medication reviews with their doctor or pharmacist. During these reviews, the doctor or pharmacist can assess the potential side effects and interactions of all medications, identify any potential risks, and recommend alternative options if necessary. It's also important for seniors to take their medications as prescribed and to avoid taking any over-the-counter medications or supplements without first consulting with their doctor or pharmacist. Encourage seniors to keep a list of all their medications, including the names, dosages, and frequency of administration. This list can be helpful for healthcare providers in assessing potential drug interactions and side effects. Consider using a medication organizer or pill box to help seniors keep track of their medications and ensure that they take them at the correct times. Finally, Educate seniors about the potential side effects of their medications and encourage them to report any unusual symptoms to their doctor or pharmacist. By taking these steps, we can help seniors manage their medications safely and effectively, reducing the risk of falls and other injuries. Proper medication management is an essential component of senior safety and well-being. Another critical factor influencing senior safety at home is vision impairment. As we age, our vision naturally changes, and conditions like cataracts, glaucoma, and macular degeneration can significantly affect our ability to see clearly and navigate our surroundings safely. These vision problems can increase the risk of falls, collisions, and other injuries. Cataracts, a clouding of the lens of the eye, can cause blurry vision, glare, and difficulty seeing at night. Imagine a senior with cataracts trying to walk down a dimly lit hallway. The blurry vision makes it difficult to see potential tripping hazards, and the glare from the overhead light further impairs their vision, increasing the risk of a fall. Glaucoma, a condition that damages the optic nerve, can cause peripheral vision loss. This means that seniors with glaucoma may have difficulty seeing objects to the side, increasing the risk of collisions. Consider a senior with glaucoma walking through a crowded room. They may not see someone approaching from the side and collide with them, potentially injuring themselves or others. Macular degeneration, a condition that affects the central part of the retina, can cause distorted or blurry central vision. This can make it difficult for seniors to read, drive, and recognize faces. Imagine a senior with macular degeneration trying to read the instructions on a medication bottle. The distorted vision makes it difficult to see the small print, increasing the risk of taking the wrong dosage. Even subtle changes in vision can have a significant impact on senior safety. Reduced depth perception, for example, can make it difficult to judge distances and navigate uneven surfaces. Difficulty adapting to changes in light levels can also increase the risk of falls, especially when transitioning from a bright room to a dimly lit one. To minimize the risks associated with vision impairment, it's essential for seniors to have regular eye exams. These exams can detect vision problems early on, allowing for timely treatment and intervention. Corrective lenses, such as eyeglasses or contact lenses, can help to improve vision and reduce the risk of falls and other injuries. It's important for seniors to wear their corrective lenses as prescribed and to keep them clean and in good condition. Adequate lighting is also crucial for seniors with vision impairment. As we discussed earlier, increasing the amount of light in the home can make it easier to see and navigate safely. Consider using contrasting colors to improve visibility. For example, painting door frames and trim in a contrasting color can make it easier to see doorways and avoid collisions. Finally, encourage seniors to be aware of their vision limitations and to take extra precautions when navigating unfamiliar environments. By addressing vision impairment and taking steps to improve vision, we can significantly enhance the safety and well-being of seniors at home. Clear vision is essential for maintaining independence and preventing injuries. Shifting our focus from visual impairments, let's consider another often underestimated aspect of senior safety: footwear. The shoes we wear play a crucial role in maintaining balance and stability, and choosing the right footwear can significantly reduce the risk of falls. Conversely, wearing inappropriate footwear can increase the risk of slips, trips, and other injuries. Many seniors make the mistake of wearing slippers or socks without shoes around the house. While these may feel comfortable, they offer little support or traction, increasing the risk of slips and falls on smooth surfaces. Imagine a senior wearing socks walking across a polished hardwood floor. Their feet slip out from under them and they fall, potentially injuring their hip or head. High heels, while perhaps stylish, are also a poor choice for seniors. High heels can throw off balance and increase the risk of ankle sprains and falls. Similarly, shoes with slick soles can be dangerous, especially on wet or icy surfaces. The ideal footwear for seniors should provide good support, cushioning, and traction. Shoes with non-slip soles are essential for preventing slips and falls. Look for shoes with rubber soles that have a textured pattern to provide a good grip on the floor. Shoes with a low heel are also preferable to high heels. A low heel provides better stability and reduces the risk of ankle sprains. Shoes with good arch support can help to improve balance and reduce foot pain. Consider using orthotics or arch supports if needed. Avoid shoes that are too loose or too tight. Shoes that are too loose can cause the foot to slide around, increasing the risk of blisters and falls. Shoes that are too tight can restrict circulation and cause foot pain. Lace-up shoes or shoes with Velcro closures are generally a better choice than slip-on shoes. Lace-up shoes and Velcro closures provide a more secure fit and reduce the risk of the shoe slipping off the foot. It's also important to consider the environment in which the shoes will be worn. For outdoor activities, choose shoes that are appropriate for the terrain. For example, hiking boots with good ankle support are a good choice for hiking on uneven trails. Finally, encourage seniors to replace their shoes regularly. Over time, shoes can lose their support and cushioning, increasing the risk of injuries. By choosing appropriate footwear, seniors can significantly improve their balance and stability, reducing the risk of falls and other injuries. The right shoes can make a world of difference in maintaining senior safety and independence, while addressing environmental hazards and promoting appropriate footwear are essential. We must also consider the reluctance some seniors may have towards using assistive devices. This reluctance, often rooted in a desire to maintain independence or a fear of appearing frail, can unfortunately increase their risk of falls and injuries. Recognizing and addressing this reluctance is a crucial step in promoting senior safety. Many seniors view the use of canes, walkers, or other assistive devices as a sign of weakness or dependence. They may worry that using these devices will make them appear old or infirm, or that it will limit their ability to perform everyday tasks. Imagine a senior who is struggling with balance problems. Their doctor recommends that they use a cane to improve their stability and reduce the risk of falls. However, the senior refuses to use the cane, fearing that it will make them look old and frail. As a result, they continue to struggle with balance problems and are at increased risk of falling. It's important to understand and respect these concerns, but it's also important to educate seniors about the benefits of assistive devices. Assistive devices can significantly improve balance, stability, and mobility, reducing the risk of falls and allowing seniors to maintain their independence for longer. A cane can provide extra support and stability while walking, helping to prevent falls. A walker can provide even more support, allowing seniors to walk with confidence and safety. Grab bars in the bathroom can provide a stable handhold for getting in and out of the shower or toilet. The key is to frame the use of assistive devices not as a sign of weakness, but as a tool for maintaining independence and improving quality of life. Explain that using a cane or walker can allow them to continue enjoying their favorite activities, such as gardening, shopping, or visiting friends and family. It's also important to involve seniors in the decision-making process. Allow them to try out different types of assistive devices and choose the one that feels most comfortable. And building upon the importance of assistive devices, let's now explore the role of home modifications in creating a safer and more accessible living environment for seniors. While simple changes like removing tripping hazards and improving lighting can make a significant difference, more extensive home modifications can provide long-term solutions for preventing falls and other injuries. Home modifications involve adapting the physical structure of the home to better meet the needs of seniors with mobility limitations, vision impairments, or other health conditions. These modifications can range from relatively minor changes, such as installing grab bars in the bathroom, to more extensive renovations, such as widening doorways and installing ramps. One of the most common home modifications is the installation of grab bars in the bathroom. As we discussed earlier, grab bars provide a stable handhold for getting in and out of the shower or toilet, reducing the risk of falls. Another important home modification is widening doorways to accommodate wheelchairs or walkers. Narrow doorways can be difficult for seniors with mobility limitations to navigate, increasing the risk of collisions and falls. Installing ramps can also make it easier for seniors to enter and exit the home. Ramps eliminate the need to climb stairs, reducing the risk of falls and conserving energy. Modifying the kitchen can also improve safety and accessibility. Installing pull-out shelves in lower cabinets can make it easier to access items without having to bend down. Lowering countertops can make it easier for seniors in wheelchairs to prepare meals. Rearranging furniture to create clear and unobstructed pathways can also reduce the risk of falls. Remove clutter and ensure that walkways are wide enough to accommodate assistive devices. Consider installing lever-style door handles, which are easier to grip than traditional doorknobs. Replace traditional faucets with single-lever faucets, which are easier to operate for seniors with arthritis. It's important to note that home modifications can be expensive, but there are often resources available to help seniors finance these changes. Government programs, nonprofit organizations, and private lenders may offer grants or loans to help seniors pay for home modifications. Before undertaking any home modifications, it's important to consult with a qualified professional, such as an occupational therapist or a certified aging-in-place specialist, CAPS. These professionals can assess the senior's needs and recommend the most appropriate modifications to improve safety and accessibility. Home modifications are an investment in senior safety and independence. By adapting the home to meet the changing needs of older adults, we can help them to continue living safely and comfortably in their own homes for as long as possible. Alongside home modifications, exercise and physical therapy play a vital role in preventing senior injuries. A proactive approach to physical fitness can significantly improve strength, balance, and coordination, thereby reducing the risk of falls and enhancing overall well-being. Many seniors experience a decline in muscle strength and bone density as they age, making them more vulnerable to falls and fractures. Regular exercise, particularly strength training, can help to combat this decline and improve physical function. Imagine a senior who has lost muscle strength in their legs. They have difficulty rising from a chair and walking without assistance. Regular strength training exercises can help them to rebuild muscle mass and improve their ability to perform these activities safely and independently. Balance exercises are also crucial for preventing falls. As we age, our balance can become less stable, increasing the risk of falls. Balance exercises can help to improve our ability to maintain our equilibrium and prevent falls. Consider a senior who has difficulty standing on one foot. Balance exercises, such as practicing standing on one foot and walking heel to toe, can help them to improve their balance and reduce their risk of falling. Physical therapy can also be beneficial for seniors who have experienced a fall or injury. Physical therapists can help seniors to regain their strength, balance, and mobility, and to learn strategies for preventing future falls. A physical therapist can develop a personalized exercise program that is tailored to the senior's specific needs and abilities. They can also provide guidance on how to perform exercises safely and effectively. In addition to strength training and balance exercises, other types of exercise, such as walking, swimming, and yoga, can also be beneficial for seniors. These activities can improve cardiovascular health, increase flexibility, and reduce stress. It's important for seniors to consult with their doctor before starting any new exercise program. Their doctor can help them to determine which types of exercise are safe and appropriate for their individual health conditions. Exercise and physical therapy are not just about preventing falls. They are also about improving overall quality of life. Regular physical activity can help seniors to maintain their independence, stay active, and enjoy life to the fullest. A physically active senior is a safer and healthier senior. While preventative measures are paramount, it's equally important to have a plan in place for what to do after a fall occurs. Emergency preparedness is often overlooked, but knowing how to respond quickly and effectively after a fall can significantly improve outcomes and minimize long-term consequences. Even with the best preventative measures, falls can still happen, and it's crucial for seniors and their caregivers to have a plan in place for what to do if a fall occurs. This plan should include knowing how to call for help, how to assess the injury, and how to provide basic first aid. One of the most important aspects of emergency preparedness is having a readily accessible phone. Seniors should keep a phone within easy reach at all times, especially in areas where falls are more likely to occur, such as the bathroom and bedroom. Consider using a cordless phone or a cell phone with a large keypad and speed dial function. Program emergency numbers, such as 911, the senior's doctor, and a family member or friend, into the speed dial. Personal Emergency Response Systems, PERS, can also be a valuable tool for seniors who live alone or have a high risk of falling. These systems consist of a wearable device, such as a pendant or bracelet, that can be used to summon help in the event of a fall or other emergency. When the senior presses the button on the device, it automatically connects them to a 24-hour monitoring center. The monitoring center can then assess the situation and dispatch emergency services if needed. It's also important for seniors to know how to assess their injury after a fall. If they are able to get up on their own, they should do so slowly and carefully, checking for any signs of injury, such as pain, swelling, or deformity. If they are unable to get up on their own, they should. Beyond the immediate physical consequences of a fall, it's crucial to acknowledge the significant psychological impact that falls can have on seniors. The fear of falling, often a direct result of experiencing a fall, can lead to anxiety, reduced activity levels, and social isolation, ultimately diminishing their quality of life. Addressing this psychological impact is just as important as addressing the physical risks. The fear of falling is a common and debilitating condition among seniors. It can develop even after a minor fall that doesn't result in serious injury. The fear stems from the loss of confidence and the realization of vulnerability that a fall can trigger. Imagine a senior who experiences a fall in their kitchen. Even though they only sustain a few bruises, the experience leaves them shaken and fearful. They become hesitant to move around their home, especially in the kitchen, fearing that they will fall again. This fear can lead to a vicious cycle. Seniors who are afraid of falling may reduce their activity levels, becoming less physically active and weaker. This, in turn, increases their risk of falling, further reinforcing their fear. The fear of falling can also lead to social isolation. Seniors may become reluctant to leave their homes or participate in social activities, fearing that they will fall in public. This isolation can lead to loneliness, depression, and a further decline in physical and mental health. Addressing the psychological impact of falls requires a multifaceted approach. One of the most important steps is to acknowledge and validate the senior's feelings. Let them know that it's normal to feel afraid after a fall and that their concerns are valid. Encourage seniors to talk about their fears and anxieties. Provide a safe and supportive environment where they can express their feelings without judgment. Cognitive behavioral therapy, CBT, can also be helpful for seniors who are struggling with the fear of falling. CBT can help seniors to identify and challenge their negative thoughts and beliefs about falling, and to develop coping strategies for managing their anxiety. Physical therapy can also play a role in addressing the psychological impact of falls, by helping seniors to regain their strength, balance, and mobility. Physical therapy can restore their confidence and reduce their fear of falling. Encourage seniors to gradually increase their activity levels. Start with small, manageable activities and gradually increase the intensity and duration as they become more comfortable. Finally, provide seniors with social support and encouragement. Encourage them to participate in social activities and to connect with others who have experienced similar challenges. By addressing the psychological impact of falls, we can help seniors to overcome their fears, regain their confidence, and live fuller, more active lives. To further empower seniors and their caregivers in preventing home injuries, it's essential to be aware of the community resources available to support their efforts. Knowing where to find help and accessing these resources can make a significant difference in creating a safer and more supportive home environment. Many communities offer a variety of resources specifically designed to help seniors maintain their independence and prevent falls. These resources can include senior centers, home health care agencies, fall prevention programs, and support groups. Senior centers are valuable community hubs that provide a wide range of services and activities for older adults. These centers often offer exercise classes, health screenings, educational programs, and social events, all of which can contribute to senior safety and well-being. Home health care agencies provide in-home care services for seniors who need assistance with daily tasks such as bathing, dressing, and meal preparation. Home health care aides can also help seniors to identify and address potential hazards in their homes. Fall prevention programs are specifically designed to help seniors reduce their risk of falls. These programs often include balance and strength training exercises, home safety assessments, and education on fall prevention strategies. Support groups provide a safe and supportive environment for seniors to connect with others who have experienced similar challenges. These groups can offer emotional support, practical advice, and a sense of community. In addition to these community-based resources, there are also many national organizations that provide information and support for seniors and their caregivers. The National Council on Aging (NCOA) and the Centers for Disease Control and Prevention (CDC) are two excellent sources of information on senior safety and fall prevention. Local area agencies on aging (AAA) can provide information on a wide range of services and resources for seniors in their communities. These agencies can help seniors to navigate the complex landscape of senior services and to find the support they need. When seeking out community resources, it's important to consider the specific needs of the senior. Some seniors may benefit from exercise classes while others may need assistance with home modifications or medication management. It's also important to consider the cost of these resources. Some resources may be free or low cost while others may require payment. Check with the resource provider to determine the cost and any eligibility requirements. By connecting seniors and their caregivers with the appropriate community resources, we can help them to create a safer, more supportive, and more independent living environment. Access to these resources can empower seniors to take control of their health and well-being and to live fuller, more active lives. As we reach the culmination of our exploration into the common causes of senior injuries at home, let's reiterate the importance of proactive measures in creating a safe and supportive home environment. By embracing the strategies and resources we've discussed, we can empower seniors to live independently, maintain their quality of life, and enjoy peace of mind while also alleviating the burdens on their families and caregivers. Creating a safe home for seniors is not a one-time task, but rather an ongoing process. It requires a commitment to regularly assessing the home environment for potential hazards, addressing any identified risks, and adapting the home to meet the changing needs of older adults. We've explored numerous factors that contribute to senior injuries, including falls, tripping hazards, poor lighting, bathroom dangers, kitchen hazards, medication management, vision impairment, inappropriate footwear, lack of assistive devices, and psychological factors. We've also discussed a range of solutions, including home modifications, exercise and physical therapy, emergency preparedness, and community resources. By implementing these solutions, we can significantly reduce the risk of senior injuries and create a more supportive and empowering living environment. The benefits of creating a safe home for seniors extend far beyond preventing injuries. A safe home allows seniors to maintain their independence, stay active, and enjoy life to the fullest. It also provides peace of mind for their families and caregivers, knowing that their loved ones are living in a safe and supportive environment. Think of a senior who has been able to remain in their home because of the safety measures that have been implemented. They are able to continue living in the community they love, surrounded by friends and neighbors. They are able to maintain their independence and continue enjoying their favorite activities. This is the power of proactive senior safety. It's about more than just preventing injuries. It's about enabling seniors to live their best lives. By embracing a proactive approach to senior safety, we can create a future where all seniors have the opportunity to live safely, independently, and with dignity in the homes they love. It requires a collective effort from seniors, their families. In conclusion, creating a safe and supportive home environment for seniors is a multifaceted endeavor that requires awareness, proactive planning, and a commitment to ongoing assessment and adaptation. It's about more than just preventing falls and injuries. It's about empowering seniors to live independently, maintain their quality of life, and enjoy peace of mind in the place they call home. We've journeyed through the various factors that contribute to senior injuries, from tangible hazards like tripping hazards and poor lighting to more nuanced issues like medication management and the psychological impact of falls. We've also explored a range of solutions, from simple home modifications to comprehensive exercise programs and the utilization of community resources. The key takeaway is that there is no one-size-fits-all approach to senior safety. Each senior has unique needs and circumstances, and the strategies that are most effective will vary depending on their individual situation. It's crucial to involve seniors in the planning process and to respect their autonomy and preferences, listen to their concerns, address their fears, and empower them to take control of their health and well-being. Remember that creating a safe home is an ongoing process, not a one-time event. Regularly assess the home environment for potential hazards, address any identified risks, and adapt the home to meet the changing needs of older adults. By working together, seniors, families, caregivers, and healthcare professionals, we can create a future where all seniors have the opportunity to live safely, independently, and with dignity in the homes they love. Imagine a community where seniors are thriving, not just surviving. They are able to age in place comfortably and safely, surrounded by the people and things they love. They are able to maintain their independence and continue contributing to their communities. This vision is within our reach. By embracing a proactive approach to senior safety, we can create a world where all seniors have the opportunity to live their best lives, free from the fear of falls and injuries. Let us all commit to making this vision a reality. Let us create a world where senior safety is not just a priority, but a way of life. Let us empower seniors to age in place with grace, dignity, and independence. Thank you.